Good morning from North Sound Root Canal Specialists. Wanted to walk through a couple of interesting cases. One in particular was in yesterday, and as a preoperative step in our practice, we take a 3D scan of every single tooth for consults, for teeth that we're going to treat, because the importance of being able to see every single millimeter of that tooth, where the canals are, where the roots are. We can locate exactly where there is a fracture, if that's present, where the sinuses are, where that tooth is in relationship to important anatomical structures like bigger nerves and blood vessels and things like that. So really important. We don't like to just use it when something didn't work or a tooth isn't healing. We want to be proactive and be able to see exactly all the information that we need to know and want to know before we touch a tooth. So this patient had come in yesterday, and so the dental assistants always take a 3D image scan and a regular x-ray, and then we get to kind of look at that before treating the patient. And this patient had a previous root canal that had not healed and actually had gotten quite painful over the last couple of weeks. The dentist had told him that most likely the tooth was fractured and that probably would need to be extracted and then an implant placed. So the patient came to see us, and in looking at the three-dimensional scan, we didn't see any sign of any vertical root fracture as we kind of went down through all the different images here. The dentist had done a nice job with the root canal, but for some reason this tooth had significant bone loss as we kind of looked through the areas, especially this area right here. And as that bone loss starts to kind of creep up in between those roots, dentists and endodontists in general start to get very nervous about a fractured root. Well, GentleWave has kind of changed our thinking a little bit in that, and if we can't see an actual fracture, we want to assume that there's probably some additional anatomy inside that tooth. And so in talking to the patient, I said, you know, your dentist did a great job with the root canal. There could be some more complexities with this tooth that regular files just couldn't get into, or the medicine didn't get down into that to help clean those out. So after treating the patient, we talk about the thrill of the fill. So this is what the standard x-ray looked like. This is that big area of bone loss here. And like I said, the root canal looks relatively well done, but the patient was extremely symptomatic and in pain. And again, this was the final result. And this was the most interesting part of this case, because not only did we have a little branch coming off of the very apical portion of that, we also saw this tiny little white line here, which was kind of up a little bit higher, and all of that pointed right towards that area of infection. And when we see that, we get very excited because something was leaking out of the tooth in that situation. And this root canal had been done 5 years ago, and it took that long for the pressure and the bacteria to kind of create this bone loss. And so on this front root, there was 1, 2, 3, and the other root 4, which is kind of behind that one, there were 4 portals of exit that needed to be completely cleaned out. And there was no way that conventional root canal treatment had the complexity to get into those spaces. And so we'll be calling the patient today and seeing how his symptoms are, but I'm fairly confident that this tooth is going to heal, and the patient was able to keep this tooth without having to go to other treatment options.